How are you? I'm Jason Nitche. I'm an orthopedic surgeon specializing in sports medicine at Ocean Medical Center in Brick. Growing up, I was always interested in science, how things worked. After I went through college and medical school, I realized that I wanted to be a surgeon and really try to help people, which then led into sports medicine. I grew up also playing a lot of sports, enjoyed playing sports, and enjoyed taking care of people that play sports and who are active lifestyle. So kind of all that led me finally to where I am now, which is an orthopedic surgeon specializing in sports injuries. So the good news nowadays is that the population is very active, and sports medicine and sports injuries is not just the 15-year-old high school athlete or the professional athlete. Young kids are involved in sports, older people, retirees. Sports medicine encompasses everybody. The most common injuries are muscle sprains, they're strains. Now, unfortunately, there's a small percentage of those that require surgery and require longer treatments. But for the average person who is playing a sport or doing a hobby or involved in an active lifestyle, and they do sustain an injury, most of those people will get better and really have no long-term consequences or functional deficits from that injury. Certain injuries are more common in different age populations. The other thing is that different sports present different injuries. People who injure their soccer may have a completely different injury than somebody who injures their knee playing baseball. So it's also sport specific, which is also keeps it pretty interesting. So a very common symptom that most people have is pain. People will tell you, I was running around first base and I twisted my ankle. So right off the bat, there was an actual injury that happened. And then the common things that we look at are pain, swelling, and how much dysfunction or disability. So most of those injuries are an acute injury. What we're also seeing a lot nowadays, especially in young kids who are playing sports all year round, is overuse injuries. The difference between those two injuries is how we diagnose them, but also how we treat them. The acute injury where someone tore something, that person is more likely to get treatment and need surgery. The patient who has the overuse injury, the most common way we take care of that is to stop doing the aggravating activity, which is take some time away from sports. The common ways that we treat sports injuries are what everyone talks about, which is RICE. Rest, ice, compression, elevation. Like I said before, most of these injuries do not need surgery. Most of these injuries can heal with what we can call conservative measures, which is letting the swelling and pain quiet down. And then as that happens, we wait until that body part returns some level of function before we go back to playing. Most sports injuries that need surgery in the young age population usually take about 3 to 6 months until that person is back playing the sport that they got injured in. What I enjoy most about caring for patients is seeing them through the entire process. From the day they walk into my office with a bad injury, finally to walking out the door, and I tell them that they're safe to go back and play sports. Not just sports, but active lifestyle and doing the things that they enjoy doing and helping them get better.